The art of cosmetic dentistry, our goal is to give you a beautiful smile. That's why most people walk in the door. But we also want to give you a smile that functions well, one that'll last you a lifetime, so that teeth don't break, your jaw doesn't hurt, your teeth don't wear abnormally early. So if it functions well, it'll last, and that's really our goal. Temporomandibular joint disorder is probably the most commonly known disease, if you will, of the mouth. When your bite's not right, when something's off, it can cause your joint to be under undue stress. It's a lot like your back, and once it's broken, it's really hard to fix. So our goal is to give you a bite that functions well, so that you don't break teeth, you don't have abnormal wear, you don't put stress on the joint that's not supposed to be there. We want it to function very evenly and be comfortable. Our office practices neuromuscular dentistry. It's a technique that I learned at LVI, which is the Las Vegas Institute for Advanced Dental Training. And basically, we use the muscles that control your mouth to help guide where your teeth want your jaw to be. And I know it sounds complicated, but it's really not. If there's a harmony between the muscles that close your mouth and the ending point where your teeth, of course, are, then everything, when you bite down, everything's balanced. There's a harmony there. And if there's a harmony, then you're comfortable. And that's what's important to us, is that when you close down, when you chew, that your joint is comfortable, there's no clicking, there's no popping, and that your teeth are comfortable where they end up, so there's no abnormal wear, there's no breakage. You end up with a healthy, beautiful smile that'll last a lifetime. One of the most memorable patients that I can recall is a lady named Kelly, and she came to me and she was in chronic pain. She was crying, she was taking pain medications regularly. She was to the point in her life where she really couldn't work, she couldn't function, she couldn't eat. She'd seen an oral surgeon and actually had reconstructive surgery on her temporomandibular joint, but she was just still in such pain. I managed to work with her and to rebuild her bite, and now she's pain-free, and she doesn't have to take pain medications, and she can eat and function like you and I, and it's just such an honor and a privilege to do that. She has no more migraines. She can eat whatever she wants. She doesn't have to take pain pills, and she's just like a normal person now. But the beauty of it is she's got this amazing smile, and I don't think I've ever seen a patient smile as big and as wide as Kelly does. And it's an honor to give her life back.
I am a severe TMJ patient. I happened upon Dr. Morgan because of a referral. With TMJ, it's the problem with your joint in your jaw, and mine had popped out at that time and the disc could move forward. I was in severe pain. It's unmanageable, and when I walked through the store, it was one of my last hopes, because that is the point where I was. Dr. Morgan started me on splint therapy, and within weeks the pain started to ease up. After the surgery, once we progressed a little further beyond that, we started with mouth reconstruction, which we are almost completed with, and we are totally pleased with, because I am completely pain-free. I have a beautiful smile, which we are totally happy with, but the most important thing is he gave me my life back, and that is the most important thing that he could have ever possibly done.